Bore da, and thank you for the opportunity to open your conference today. I can see that you have a full and busy programme touching on important and emerging areas of research and practice. And I want to start by thanking you all for your hard work and dedication in supporting a vulnerable and often stigmatised group of people in our society. Substance misuse touches so many people's lives, but far too often it goes under the radar. Most of you here today will be aware of the figures published late last year, which recorded the highest ever number of drug misuse deaths, a 23% increase compared to the previous year. But these aren't just figures. Behind every number was a person who has left behind a partner, family, children, friends, and loved ones. And the real tragedy is that every one of those 253 deaths could have been avoided. As a government, we are committed to supporting people who misuse substances and tackle the harms associated with both alcohol and drug misuse. Data and reliable, up-to-date information about trends is vital if our approach is to be successful. And I welcome this opportunity today to build new relationships and partnerships and productive networks, drawing on new digital and data expertise, while showcasing the value of administrative data research, an area in which Wales is a world leader. Our substance misuse policy is rooted in a harm reduction approach, which recognises substance misuse as a public health issue rather than one solely related to the criminal justice. And this means we have to consider the wider causes of addiction and substance misuse, as well as their impacts. This includes access to education, quality housing, healthcare, good employment, and financial security. And we also know that so many of our service users have been deeply affected by childhood exposure to adverse childhood experiences and to trauma. In 2004, the cost of alcohol harm to society was estimated at £27 billion for England and £800 million a year. And based on 2019 report of the illicit drugs trade across society, that's £19 billion a year. So against the backdrop of one of the most difficult financial times that we have experienced since the devolution, we have worked very hard to maintain our investment in our substance misuse agenda to just over £67 million in our next financial year. And while we have made some progress, I'm aware that for many people, having a co-occurring mental health and substance misuse issue still presents a major barrier to accessing services, particularly for those who may have insecure housing, be homeless, or involved in the criminal justice system. We increased our funding in 24-25 to £4.5 million to support this work, and we are working across government with housing, education, mental health and the criminal justice sector to ensure we can offer wraparound support tailored to the needs of the individual. We will continue to ensure drug death is reviewed in real time, and we are working to ensure we use this learning to support trends earlier and adapt to new challenges. But we need more if we are to make real change and improve outcomes. We need to see greater understanding, innovation and change, and partnership working will be absolutely key to this. One of the areas where we have seen innovation and change is in how we can use data and evidence to improve life outcomes for people receiving substance abuse treatment through improving the assessment of additional needs where individuals come into contact with any government service. And this is where BOLD, Better Outcomes Through Linked Data, programme has shaped a better understanding in supporting individuals with complex needs by joining up that data across government to ensure policies and services are grounded on the best evidence. And we will hear today of how the BOLD Wales team developed an ambitious and cross-cutting substance misuse research programme, adopting a life course approach. The BOLD Wales team are very much looking forward to presenting the evidence from the 3-year research programme and providing the opportunity for us as policy and service leads within Wales to develop linked policy approaches and identify service improvements based on the recommendations and expertise on offer here today. Having worked in the Data Justice Lab at Cardiff University, I have seen firsthand the transformative power of data in addressing social issues. Linked data allows us to track individuals' journeys through different services, identify patterns and pinpoint areas where additional support is needed. For example, we can examine the overlap between substance misuse and mental health issues, enabling us to develop targeted interventions that address both problems simultaneously. And this approach ensures we are not only treating the symptoms, but also addressing the root causes of substance misuse. I know this is often proven challenging because information about the challenges people face is held across different departments and administrations, and not frequently shared. Services for vulnerable people are often provided by separate organisations, and because data is not regularly shared, these organisations cannot access sufficient information about what interventions work. And those without stable accommodation or employment support can then struggle to access and stay in treatment. The Substance Misuse Pilot Project has given us a better understanding of what factors drive successful rehabilitations from addiction for particular groups, such as prison leavers or rough sleepers, so we can better support and help individuals and their families who are affected. And the Welsh Government is committed to ensuring that our policies are grounded in robust evidence and driven by a commitment to justice. So I am really pleased to learn of the progress the board programme has made and their aspirations to do much more with your data and the data about those who you support. And I am also pleased the Public Health Wales and ADR Wales, including the Sale Data Bank, have been part of the Ministry of Justice-led BOLD programme and really look forward to seeing what BOLD can achieve in the coming years. As we move forward, let us continue to embrace innovation and collaboration, ensuring that our policies are informed by the best available evidence. Diolch yn fawr.